difference. This is um, a Horowitz diagnosis of it, that when you have a trauma, what happens to you is, one, you first take a shallow breath, you're in it, you do whatever you need in that time. And if you're on the other side, say it's a car accident, you had a car accident, and then you're home and you realize your car's okay, you're okay, everything is fine. And then, like, oh, I could have done this differently, or next time I'm going to do this, and you resolve the situation. In, for example, war trauma, and many of the traumas that we did mention, um, you take a small breath, you walk through it, and you also tell yourself something about the trauma. You're walking through it and you tell yourself something. But then in war and in others, you can't finish it because you're not safe. So you don't really you don't really look at it until another time when you do feel safe and you do feel more in control. But there's another time that happens. So you can do that and say start in therapy and work, and then you get to the trauma and it's very painful, but you walk through it to end it and resolve it in a different way. Now, say you're in war, you can't do it. So you numb and you react. And an example of this, say, for example, I'll use a Vietnam War example. You're in a firefight. Everything goes really fast. It's confusing. It's over with. You get the bodies, the dead bodies out in body bags. You get the wounded out, and then you see the blood and everything there, and you realize, my buddy just died. He has my back. I'm alone. What do I do? We're still in danger. I have to keep walking. So it's buried, it's buried, it's buried. And triggers come from the trauma is buried and buried. And when it is triggered, and it's triggered by our senses, we smell, taste, touch, seeing, and hearing, it comes up, a trigger comes up with the same intensity as the original trauma. So it's very scary. And that's the part that we try to heal. The other piece is, what did you tell yourself as you were walking through that? And we look at that. And when you get down to the nitty gritty of trauma, the heart and soul of it, you're really dealing with those kind of issues, what they told themselves, what went into their brain. And those are issues of meaning in life and purpose. And those are the issues, the existential issues actually, that are the core of treatment. And when I talk about treatment and I say you need a comprehensive assessment, I really mean we really have to know what's going on with a person. We have to know physically what's going on, mentally, emotionally, their support system, psychosocial, so we can help them work through all this with helping them empower themselves and come to terms with it and look at it in a different way. So can I add one more thing about this?
Yes, of course.
So when I present this picture like I am, I have to tell you, post-traumatic stress, when in the DSM-3, which is a diagnostic statistical manual that we in the mental health profession look at to see how to treat different disorders. And at that time, and from now, it's been like 50, well, how many years from I think it was went in 1980. It's been changed. And now, and in the new DSM-5, they've taken something away, and that's what I really wanted to tell you about. They've taken away the loss and grief, and they're looking at that as complex grief now. Before that, it was kind of mixed in with the post-traumatic stress disorder, but it really does need to be looked at, because as we talk about all these traumas, in these traumas, there's tremendous losses and there's tremendous grief. And we have to help our people through that. And the truth is that when we are doing losses, they're really a regular loss. It would just be, say, somebody dies that you love. You go through yearning, you go through acute longing for them and other things. And then you work down and you deal with what this person really meant to you, physically, emotionally, and you come to terms with it. That is not a disorder. That is how the human being heals the hearts when we lose somebody we love. But when you can't deal with it, it becomes complex. And then it becomes very, very scary um, because it's so painful. So I wanted to, that's like a leg in with the whole diagnosis, because there's so many things going on in a person's life and their support systems and everything else. So I wanted to bring that up because I think that for me, that's where the alternative, the therapies are helpful, like connected breathing, like yoga, like acupuncture, like Reiki, like mindfulness. Like, well, mindfulness is more moving into it is a therapy, but other things that we mix with it, because the actual healing is um, is the core issues of that person's heart. And I think by doing the breathing, we help the person get back into their body. And it could be, we could consider it self-soothing. We could consider it like with the connected breath. Our breath we always have. And by breathing, we try to get back in balance. And this is very important. It gives new insights into what you're working with. And also, it helps the person know that there's something that they can do. But there's another big piece of why this is important too. And that is because we don't grieve alone. And in our society, we don't get good grades on it. It used to be we lived with families and we lived in a neighborhood, and there were rituals and religions how to help with this and follow it. And even at sometimes you would have parlors that you'd put the dead body in, and it was recognized as the heart is broken, and you help and support that person through it. And many times with trauma, people don't have this anymore. They don't have this. It's a spiritual side really that gives hope and connection. So going back to the breath work and going back to these other issues also helps them center in their true core issues of what life is, what meaningful life is about. And that's when we get into spirituality. So I wanted to make sure I said that. And actually, because I said that, I wanted to read something that one of the vets told me. And this was, oh my gosh, it was in the 80s. And he was an artist. He was in Vietnam. He had a lot of trauma. And this is what he said. We do not share these wounds with others, and sometimes buried so deeply that we hide them from ourselves. But they are alive within us and they grow. We need safety to share them. So the safety is built in relationship with the therapist, but there's a call for community and others to understand that this is normal. And when we're stuck and it's complex, we do need the support. We do need help. And this is why I think yoga, the connected breathing are really, really helpful for us. So, and then I want to read an Iraq. This is very, very common as what, when we're talking about this part of healing. They ask, who am I now? Where is God? What is my purpose? And this is from a Marine. And he said, The people coming home from war are dying inside day by day. The ones that have died in war have freedom. And this is a core of what it's a very special, meaningful, it's almost like a sacred space to help somebody work through this. So I'm really saying it's holistic. It's we need to add outside things that help with this. Help when I say outside, I mean, as a scientist doing our work here, but complementary to the healing process. And breath work is one of those.
Thank you so much. That was beautiful. So, what give me some symptoms like when someone is going through reintegrating in society, coming from war? What would be some symptoms that they are in PTSD and they should be looking for help?
Well, um, when you when you go through those situations, and again, this is a core issue that you work on. Your safety in the universe is pulled away. It's like I don't have any more safety. So one of the issues is trust, and well, I can tell you it's exactly the same. Well, every war, it's really the same. It just shows up a little differently. Um, what usually brings a person into treatment is the fact they feel out of control, they don't fit in, and does anyone know we're in war? There's a piece to want to connect to us. For symptoms, it's nightmares. The body always wants us to survive, always wants us to move forward to a healthier way of looking at things. And so nightmares are common. And triggered, that they've been triggered from some event, um, and that has them come in. For example, when our young men and women who started coming back from Iraq and Afghanistan in 2003, we saw a lot of World War II veterans who were coming in for their very first time, retired. They had worked their whole life. Many had become workaholics, but they've been denied, you know, they have not had to face what was really in their trauma until the other men came back. So with PTSD, there are arousals. They get angered easily, and they don't really know why. And they feel like, and that would be like feeling like they're out of control. And the flashbacks, the triggers, those are the main issues that bring people into treatment. But with treatment, and if you don't do it, and if you don't help yourself, what we're finding out today is that could increase, for example, medical problems. We always said stress affected it. This is really deep stress, and they it is believed, and it's also in the DSM-5 that it could cause heart attacks, high blood pressure, the affecting our immune system, just for some,
Yeah.
which again shows how we do a lot of treatment is education, eating right, sleeping right, helping with those kind of things, and relationships and support, their support systems, and that they have to do that. Um, and do breath work, which is self-soothing and a way to understand, to let things go, that they're not afraid it's gonna come out at another time. Um, but they come back with no safety. And the young men that come back today, most of them carry, because your buddies and your relationships, which are so intimate, um, are your safety in war, and so is your weapon.
Mm-hmm.
So that's how they try to come back in to carry that. And then the transition is coming back in, and it does cause relationship problems a lot, because their expectation of what they've learned about life and what they've learned about survival and intimacy when you're back to back with somebody and you're depending on their life, that's different than just getting married and getting to know each other. And it's like, oh, so you might say to a vet, so you're expecting your wife to read a Russian book and know it by tomorrow. You know, it takes time that a relationship grows, and just helping them see that, where they are, and also it's a lot of empowering of, look what you did, you made it, you survived, you have something at your young age, you know, something wise about life, that it's fragile, that you can lose it, and you know how to live it with dignity, respect. And as I said, when they get down to the core, they're really looking at spiritual issues. And I think the alternatives really help with that.
Mhm. Thank you so much. I really love this topic because, I've been working as a breath worker for so many years, and the primary trauma that I work with is like birth trauma, early childhood trauma, uh, or, just teenage trauma. Anything below teenage years is mostly what I work with. So, um, would you say that early childhood trauma and adult trauma affects the brain in different ways?
Well, I would say that, um, when you walk through it as a child, what you tell yourself about what happened, that's very important as how the child is raised and what they do in their life. Um, and with breathwork, we really do look at that. But the brain does change. It goes, our frontal lobe tells us, is this a medium stress or small stress, or we know how to do it. But once there's life and death, and it kind of hijacks it, and it goes to another part of our brain, which is called the amygdala, which is dumb. It doesn't care what's there. And that's what we're really, science is looking at, to try to, how do we remap it to take that out? So because it drives us, it's unconscious, and it drives us what
So
those
what I'm
messages.
hearing, so what I'm hearing is it's the same. It affects the brain the same, whether you are 1 year old or where you are 45. It affects the brain in the same way. Yes.
I would say that. Um, I I would probably have to do more research on it, but I think that that's right. And that's why we look at the whole life, because what happened before you went to war? What was that like? What was your perception of life? What were your self thoughts about yourself? How did you cope? All those things.
Right.
And what I can say too, I said a lot of physical illnesses, but not not helping yourself in going in to try to go heal. It could go into, you could go into depression, have a lot of anxiety, have other things come out of it, because it's very hard to work through the trauma. And what I guess I want you to hear today, this is my opinion, a lot of the trauma is around lost, profound lost, and healing. And so when you have the whole picture of the person, and their family history, how they've lived life, their experiences, these are extreme, profound loss. And we need to be doing more of
Grief
understanding.
work. Yeah, yeah. This is great because how I see it, well, I was trained in my training about breath work is when a child goes through a highly stressful, life-threatening situation, they can't process because their frontal lobe is not fully developed and they can't process everything that's happening, so it gets suppressed in the subconscious. And I guess in regards to war trauma is the adult who's going through the war, it doesn't have the time to process everything that's happening and it gets kind of hidden in the back and not now. I can't handle that. I'm in survival mode. I have to focus.
I'm not safe.
I'm not safe. Yeah.
You never process without being safe.
Right. It's not a safe place to process all of that.
And
And,
then yeah,
and
it's unconscious.
it
And
goes
then
into,
it comes, but it's still there, it's still growing and pops up in triggers.
and you
And,
process.
and
Yeah.
another, it can be other triggers too that you don't even think about it. Different wars have some different triggers, but one that's not so popular is going into a mall, a shopping mall, because you can't see where the danger's coming. When you go into a building or a restaurant, you check out where are all the exits, where are all the doors to go in and out. Or you may, when you go in a restaurant, where you sit with your back against the wall so you can see everything. There's um, a lot of safety tools and behavior to stay safe.
Yeah.
And in relationships too, it's the intimacy. I can't handle one more loss, so I can't marry this person.
Mm-hmm.
If that person died or whatever, I wouldn't be able to handle it.
Yeah. So it
Um,
prevents them from living fully. I see.
yes,
So let's go over, if we can, on like how breath work helps um, war trauma. I love what you talk about safety, because that's number one thing that I established, right? And we establish as breath workers is that safety level, and circular connected breathing helps establish that safety in the mind, in the breath, that you're safe in this moment, in this breath, you are safe, right? Um, so one of the ways the breathwork can support war trauma and help veterans is to increase their safety within themselves, right? To, to
yes.
and what else?
It's
Reestablish,
yes.
to
Uh-huh.
reestablish connection, and then connection with other people. And what other ways can breathwork support uh, veterans?
Well, Sula, the things you just said are big, and that's pretty good. That it's safe to go in your body. It's safe to see what your body is telling you through the breath work and what comes up. It helps you, it empowers, it helps you to realize there's another way that I might look at this trauma. Um, I hate to say it's like a tool, but it's a healing tool.
Mm-hmm.
And it's trusting that and being aware what's inside, being aware what's outside. All those things help bring balance. And then when there's balance and safety, you can hear different areas, but different things to, what am I saying? You, you, you can, oh, I can look at this differently. Um, I'm going to give you another war example. I had this vet say to me, my sister is dying, and this also goes with war trauma, and I can't do anything for her. So I said, so you feel helpless? And he said, yes. And I said, is there any other time in your life where you felt helpless? And he said, yes. This also is a Vietnam veteran, Marine. He said, we were in a firefight, and one of the men went out and he was shot in the leg. Well, that is a situation that's set up to draw other people out so they can be shot. So he had to make the decision, I can't let my men go out, and I have my other men crying with the death curdle that you never forget. So I said, well, what did you do? And he said, well, I told my men they can't go out, and I sent the man in the field all my love. And so I said, well, I thought you said you didn't do anything. But then we said with his sister, that's what he could support her with, the love. So um,
Yeah, so I had that on my notes also in regards to helplessness. I mean, I see it on a regular basis how breathwork supports people in getting out of helplessness. Um,
Right.
and also, you know, I can see as we talk further on this topic how breathwork will support them in sleeping better, in self-soothing, in managing the anxiety and the stress level, and also to help them focus, and just create that relationship, a new relationship with the body. Don't
It's
you
a new,
think?
yes, it's an, and all those things, right, which, that you said. It is, it's not, all connected breathing isn't all nice, nice. We do get other things come up, but it's self-control. It could be self-soothing. It could be, um, a relationship with self. It's
It's
self with self
nourishing.
and self with the world.
Yes, it's nourishing. It would be self-love, increase that self-love and connection, and then from that space be able to connect with others in a more meaningful way. Yeah.
And the others are the breath work are there. The
Yeah.
others are, if you do it in a group, it's the need to be seen, heard, and valued is like our bottom line needs universally.
Right.
And to create a setting, so that could be your external setting, with a group of people that you can say whatever you need to say, and you're not going to be judged, you're going to be heard, and it's safe. These are, um, values of a human being, I guess I can say, that we need to give to each other. And that
Mhm.
can be the therapist with the person, the rebirther, but also, I really expect the community to set up. We've lost a lot of our connection
Right.
on this kind of level.
Yeah.
But on this kind of level of connecting, we become human again, and we
Hmm.
heal the heart. And the heart only heals this way. It doesn't care what science says or anybody else says. It heals with our connection with intimacy, seen, heard, and valued. We give that to each other.
Beautiful, beautiful. Thank you. So, you know, breath work would help them heal their heart and all of us as well. So, so we're almost closing here today. And on the topic of being seen, heard, and valued, I think that us as breath workers, we do a great job on that, in group therapy
Yes,
also.
yes.
And so I want to ask, are you teaching any groups for veterans? Are you planning on teaching like a breath work for veterans?
Well, I have to say that, I've continued to do a lot. I am retired now, working with vets. I think when you have a career that you are dealing and are able to deal with people's hearts and souls in this kind of work, is something. Who had a better life? That's what I say. It's so meaningful, and I would say that, the group that I volunteer with, which is civilians and, military, um, I I am working with some of the vets, and the goal of doing a group with a vet, I think, would be awesome.
Yes.
So it's in the making. Um,
I
it's in the
encourage
making.
you. I want to encourage you to do that. And also let people know that, you know, this recording is going to go on YouTube. And I really would love to, the reason that I'm doing this is so if there are any veterans out there who are suffering, who are feeling alone and in helplessness, that there is something that they can do and that they can reach out to us and find a breath worker or a group breathe. You are in the Broward County near Fort Lauderdale. I'm in Palm Beach County, and I have a class every Wednesday at 6 o'clock. Excuse me, every Wednesday at 7:30. It's only $15 drop in, and I and research. You know, I am inviting all of you who are watching this in the future to give breath work a chance and find a breath worker near you, or we can do video sessions. I am sure that Sherrill is available for that. And there is so much more than breath work can do in this realm that I'm just really excited that you and I are having this conversation, and that perhaps we can support and help others from
Mhm.
this connection from today.
Okay,
So that's my
sounds
vision.
good.
Yeah.
Well, Miss Sula, thank you for inviting me today. Um,
You're welcome. In closing, is there anything that you would like to say? Like as I said, in the future, this is going to go on YouTube. If there are veterans out there who haven't tried breathwork, or again, who is looking for some relief, what would you say?
hmm, um, gosh, I I would say that it's important that you care for yourself, that you eat right, sleep right, that you connect at this level again, that you have a big gift to us. And your gift to us is that you're really wise, and you have so many wonderful values of dignity, respect, um, appreciation of other people that have and are willing to meet other people at the same level that you do with your buddies. So if you need help, if you're having trouble, please reach out. Please, please reach out to other people besides vets, and know that we want to help you. That that there's many people in this world that want to help and don't know how to find you, don't know where you are, and care about your service, and are so thankful for it. And I know you don't see those people as much as we civilians do, but I want you to hold that in your heart too.
Beautiful. Thank you so much, Sherrill. That is so beautiful. I'm so honored and grateful that we are having this conversation. Um, so that was really beautiful. Thank you so much. So this is it. Is there anything else you want to say? Do you feel complete?
Uh, Sula, well, what about you? Do you feel complete? Anything else you have to say?
How does it get even better than this? And what else is possible in the world of healing trauma, all traumas? I mean, I work with all kinds of things, from physical injury, from surgery traumas,
Yes.
from relationship trauma, like recent divorce, losing a partner or a child. And so we are really here to support all of that and what else is possible in that realm, to bring back that safety and the connection and the oneness. So in closing, thank you so much. This is Sherrill Valdes here with us, and I am Sula DePaula. You can find me on my website, suladepaula.com. And that's it. Have a nice day.